Hello, everyone. Can you hear me? Just let me know if you can hear me. Brilliant. There is always a few seconds delay between me talking and perhaps you hearing me, but I understand that, so I can see that people are logging in now and they can hear me. So today, unfortunately, we are not going to be able to use speak requests. So this means I will be talking, and whenever you want to ask a question, you need to type it in as you are doing now. Do you understand that? Great. So just a few minutes before we start, so I can see that people are still logging in, and it is the middle of the afternoon. But like I said, we'll wait a few minutes, and I can see there's 35 people logged in already. So I imagine in the next couple of minutes, people will start registering. So just bear with me. I will start at 3 o'clock. So for now, just you know, talk for a bit whilst people register. As you can see, I'm not in my office, and I explain why you may think I'm not as well in a minute. The important thing is that you can see me and you can hear me. So whilst we wait, just very briefly, tell me, have you had a good break? Christmas, New Year? Good to know, Ashley. Well, I have an interesting story to tell you all, but maybe I won't. You know, too much family over that period of time can be quite overwhelming. As much as I love them, it's good to have a break from them sometimes. Dale, yes, asking on my mind. I don't think there's anybody in this chat room today that didn't have their OSC in their minds, but that's okay. It's a good sign. You know, it tells me that you care. Family is good. Yes, it is very good. Maybe you want to come and spend some time with mine, Itoan. I love them honestly, but they're a bit intense. Okay, right. Why not? Okay. Well, you've been warned. So it's 3 o'clock. I see that some people are still registering. Adina, hello. Welcome. So what I'm going to do now in the next 5 minutes is just to give you a brief introduction again as to what we are going to be doing today. So 54 people on, okay, so more are registering. So for those of you who are already online, can can I have a really quick yes or no? Is everything okay with the webinar? Can you hear me well? Can you see me well? Just a yes or no, so I can perhaps try and correct any problems. Fantastic. So everybody, it's on, it's saying yes. So brilliant. Thank you so much. It really helps me because of course I can't see what you see. So that's a good start for me. So as you can see behind me, and I've just noticed that you will tell that this is not my office because you can see right at the back there. Can you see? There is a baby doll. That's not a real baby, okay? Really is not a real baby. So I'm in one of the children's nursing office, and we've run webinars from here before. And so I just thought it would be a good place to set it all up again. But no, that's not a real baby, just stuck there. And these are real biscuits though. I'm going to steal some in a minute. Okay, so today is about an overview of the OSCE Day. And, we've been going through lots of things in the last 6 months almost. And we've done so much. So just a quick recap. From day one of the module, you had a few sessions on anatomy and physiology. And that was session 1 and session 2. So you've covered the respiratory system, you covered the neural system, you've covered sepsis and the cardiovascular system. So the reason why we didn't do hypovolemia is because literally if you've covered sepsis and the cardiovascular system, it gives you a really good understanding of what would happen with the circulation system if someone is actually fluid depleted. Okay, so we've done that, and then in the next 4 sessions of the module, we've worked with lots of different scenarios, and the idea was that you would build an understanding and knowledge, of course, and the skills to do a assessment, an A2E assessment of a patient who is deteriorating. And in doing so, you would identify what you would need to do for that patient according to guidelines. And we've looked at the guidelines, we've explored many of the guidelines. And also you would then have an understanding on what you needed to know about the condition that you will manage. And so we looked at pathophysiology of 4 different conditions. So that's where we are. And then we did a review session for the OSCE, both at Havering and Southwark. And I've also put on Moodle a video of myself doing an A2E assessment. And I think that you've got enough information there to do well in your exam. Since day one, this is something that I've really reiterated. It's all about practicing. So the people who came back to the OSCE practice and they did a practice, and some people came back and they had been practicing, and other people said, actually, I came back today because I haven't practiced. And then I think when they came back, they, as you may have realized from talking to your colleagues, they said, actually, it's not as bad as I thought, and also is to do with practicing. So I think they've realized that if you really want to do well in your OSCE, it's all about practicing. Okay, so preparation is key. And of course, we're just a week away, so you really need to now be prepared for your OSCE. But if you're not, you do have a week that you can put in, a lot of effort in case you haven't yet, and do well in your exam. Okay, so I'm hoping for everyone to do really well. So what I'm going to do now is to give you an overview of what's going to happen on the day. And as soon as I talked about that, I will leave then a space open for you to type in questions, okay? What you think are your last burning questions. What I don't want this to become is, a session where you're going to ask me everything about the OSCE, lots of questions that have been asked before. I want you to understand that this is an exam and you need to be prepared, okay? So there are certain things I will be able to answer. There are certain things I cannot, purely because this is an exam, and it would be, with everything else, you know that there is, you've submitted lots of essays and there is a limited amount of information that we can share with you. The rest of it is about preparation. But I am confident that if you follow the materials that we have on Moodle, if you remember what you've done during the sessions, you will be able to do well, okay? So it's just about preparation now. Okay, so if you look at your Moodle site, what you have there as well is some information on what to expect. So there is a document there called an OSCE overview, okay? So I'm just going to run through quickly. I have it on another screen here. And I'm going to read through step by step and just think about it, and you can read it as well. And then we'll go into the practicalities. So can I just very quickly ask, are you still with me? Yes, okay. Very good, very good, very good, very good. Thank you. It's good to ask because sometimes there could be, problems with the signal or the wireless here or at home, but good. Okay, right. So I'm just going to go through right now what the assessment actually is for the very last time. Okay, so the assessment will be an OSCE and it will be in three steps. So in step 1, you will have a case scenario and you will be assessed on performing an A2E assessment, doing an SBAR, calculating the new scores, and then you'll be asked the normal parameters for vital signs, fluid input and output, and blood glucose levels. Then in step 2, you'll be asked to provide an evidence-based rationale for your clinical interventions, which are the clinical guidelines that you have used. And also you will then be asked to say what human factors interfere or, that can affect performance in clinical scenarios. And then in step 3, you will be asked to outline the pathophysiology of the condition, okay? There will be 4 clinical scenarios: sepsis, acute chest pain, exacerbation of COPD, and hypovolemia. You will be asked to arrive on the day 15 minutes before your allocated time, okay? And we will discuss that again. The time for your assessment is 30 minutes. So from the time you walk in and we explain to you everything that is in there, and then we will give you the information and we say, are you ready? From when you say, I'm ready, we start counting, okay? So you will then have 30 minutes. We said that it would be a good idea for you to have about 5 minutes to read the scenario that you'll be given, and then start your A2E assessment, and then do the rest of it. Do your SBAR, do your normal signs, your clinical guidelines, and then the pathophysiology. We will tell you 5 minutes before the OSCE ends, okay? If you are a student who has DDS arrangements, we have been told of your extra time, and so this has been allocated. What I would like you to do is that if you don't need the extra time, just tell me so we don't use it. And when you do come into the room, that you identify that you have extra time as a DDS student, just to make sure that on the day we have all the same information in place, okay? So again, we will tell you 5 minutes before the OSCE ends, so you know you still have 5 minutes left, okay? So let's go through now what's going to happen on the day, all right? So you've got a list there of your time slot and the day that you need to attend your OSCE. This is for both Havering and Southwark students. So you know which day you are attending your OSCE and you know what time you are attending your OSCE. The reason why we ask you to arrive at least 15 minutes in advance, of course, is that if you, for any reason, need to go to the toilet quickly and you don't want to be late, you are there before all of that. So 15 minutes before your time, you are waiting outside. You will have had time to go to the toilet, to go and grab some water and do everything else. And we want you to be there 15 minutes in advance, knowing that you've done all of that. If, in case you are sitting there and you're thinking, I need to go to the toilet again, as some people will, then you have time to do that, and you don't need to rush around. However, be careful. Don't try and arrive like an hour before, because during that week, every nursing field will be having their OSCE. So there's going to be lots and lots of students around, okay? And word of advice, try not to talk to too many people, because what can happen is that you start sort of, the anxiety and being nervous starts rubbing off, and you talk to someone and they're anxious, and you talk to someone else and they're anxious, and you start becoming anxious and panicky. If you've prepared, come in and stay focused, okay? Use that time for yourself. It's okay to actually help and calm someone down and, talk about other things and good things, but please don't panic altogether. And try and keep calm, okay? It is a day like any other day. You just have to do an OSCE. So what you know is that, if you really calm and relax, that will work in your favor. So try and do that, as difficult as it may sound. Okay, so you will arrive at least 15 minutes in advance, and here at Southwark, for example, or at Havering, there will be someone meeting and greeting you, okay? So before I go into any more details, the rooms that you have allocated for your OSCEs have changed. Hooray! Not much, okay? So don't panic. I'm going to put that information on Moodle again. So you will be essentially in the same place, just different labs. And those things, they change, and you know this. So I'm not even going to try and make any excuses. It has changed. I checked today and it has changed. So I'm just going to update you. It's nothing major, trust me. It's just you be in the same place, just a different room perhaps. And some days it hasn't even. So for Havering, don't worry about it. Nothing has changed. For Southwark, at least in one of the days, that has changed. Again, don't panic. It's not a problem. You will be advised tomorrow where to go. So you arrive 15 minutes before. There will be someone meeting and greeting you, and they will sit you down, and they will say, okay, this is where you are going to be going to, and just wait here until you are called in. Please come with your name, student badge, so we can identify who you are. And remember, you need to be wearing your uniform, okay? So bring with you your student name badge and your uniform, and be changed, ready to start your OSCE. If when you get here, you realize that you've forgotten your badge, don't panic. Remember, you can get a temporary one from downstairs, from the main reception, same at Havering, okay? We want you to do well. We want you to do the OSCE. So we're probably not going to turn you around because you've not had, you don't have your name badge on. There is a way of getting it. That's why we ask you to arrive earlier, in case anything like that happens. And when you're nervous, you forget things. So same with your uniform. Please bring your uniform with you, and you will be sat there waiting to go in and do your OSCE. And someone will have indicated to you where you're going to go. You can bring a bottle of water with you. Okay? You can bring a bottle of water with you. No hot drinks, no food. Remember, you will be in the skills labs like any other day. So when you go in, there will be 2 stations in each room. So 2 students will go in at the same time, and the stations will be different. So there's not going to be, for example, hypovolemia and hypovolemia. One station will be hypovolemia, one will be sepsis, for example. So it doesn't matter what other if you overhear someone talking, it's not going to be the same scenario anyways. So nothing to do with paying attention to what other students are saying. And just so you know, we have thought about the fact that there's 2 OSCEs running simultaneously. All other fields of nursing do the same. So actually, to be fair to everyone, we just continue to do the same. Okay, I am aware that in the previous year, the OSCEs were in a room individual. So that has changed, unfortunately, and to be fair to everybody else, it has to be like this now. But I've also sat in with the children's nursing students, and they had the OSCEs in the same style. It was actually a little bit more relaxed because they knew other colleagues were going in at the same time. It was less stressful for them, and I sat there and there wasn't any problems at all. Right, so you come in, then on your station, you will have the OSCE scenario. So there will be a scenario there for you to read. You will have your news chart as we have used before. So you have your news 2 chart, and you will also have, together with your news 2 chart, the parameters. So you can look when you write down your news scores. And on the last page, you will have your clinical response in case you need to complete the news chart. So you will have this scenario. You will have this. What you will also have is this. And I'm going to share this with you now in case you haven't already. So let me know if you can see it. Great, fantastic. You can see it, right? But have you downloaded it? Right, fantastic. Okay. When students came back to do the practice, okay, some of them were not quite sure what to do with this, and it was a bit of a shock for me because we have gone through this, okay, but just for the purpose of what today really is, which is to clarify all of that, I'm going to give you a tip on this, okay? So when you come in and you see your scenario and you're doing your reading in the first 5 minutes of that scenario, what you will see here is A, B, C, D, and E, okay, which is your A to E assessment. And underneath, you will see S bar. My tip is, so you can write there what you need to remember in each part of the assessment. So for example, A, you can write patent or obstructed. Okay, so that's what you will need to check. And look, listen, and feel. So if you write there, look, listen, and feel, when you're there, because you can take this to your bed space, when you are there doing your assessment, you will remember that you have to cover look, listen, and feel in A. Okay? And you can tick them as you go along. So B, what would you check in B? So you want to check as a minimum the respiratory rate, the oxygen saturation, the chest movement, right? So you can write those things there as what you need to check. And you can write it in every single part of the assessment. And then when you take this to the bedside with you, what you can do is, well, I'm checking the airway. This person is talking to me or it's not, I don't know, depending on your scenario. And the airway is patent. If it wasn't, I would look, listen, and feel, because you won't forget that. It's written there. You can look and see what you're going to check, okay? And the people who did this in the OSCE practice found it amazing, and they were very surprised that they could do that. So again, I'm saying, most of you know that you could do this. So it's just a reminder and a tip again as to what to do with this information, okay? Use those 5 minutes to give yourself those prompts as to what you need to cover during the A2E assessment as a minimum. And you can write everything else there. So you don't get confused. What people were doing was to take this to, as in blank, taking this blank to the bed space and writing here what they were finding, as in what's the respiratory rate. But that's your News 2 chart, okay? So you have to decide how you're going to use it. But if you have there as a minimum what you're going to check, yes, you can use this and say, okay, the respiratory rate is 22. But remember, you will still need to complete your News chart. And if you watched my video, I went backs and forwards, making sure that was written on the chart so I didn't forget. Or you can write it all here and then transfer to the News chart. It's entirely up to you how you've been practicing what you're going to do. It's just a tip, and I think it works really well. If you, as soon as you walk in, you have those things in mind, you write them here, so then when you go to the bed space, you know what you need to cover. That works really, really well for the students who came to do practice, okay? So, same thing with the S-bar. The S-bar is actually something that most students didn't have any problems with. But remember, you need to do things in a standardized way. And, you know, just think about what's the situation. You don't want in this situation be using your precious time for the OSCE to talk about the background and then repeat everything again in the background. So that's the skill that hopefully you have developed all this way, also after class, because you've done some time in clinical practice. And I just want you to use your time wisely. That's why I'm saying these things, okay? So that's why this is really, really useful, okay? Don't take it with you blank. Take it with you with all the prompts that you will have written. As soon as you come in, you read your scenario, write down all the things that you need to check regardless of the scenario, okay? And do it as you go along, as you do your A2E assessment. It will also save you time. Okay, so the other thing you will have, let me see if I can share that with you as well, is a marking grid. Okay. So the marking grid is for us. Remember, that is entirely for the markers. In your station there, you will have the scenario for the OSCE, this form that I just showed you, which is for you to make all your notes on. You'll have your news chart. Remember, you have to complete it. You will have a pen, a calculator there too. You can take a bottle of water with you, and we will be using the marking sheet, okay? So you know what you're being assessed on. That's an example of the marking sheet. You've been working with it. It's not a big deal anymore, but it covers all aspects, okay? So also what you will have there is, for example, if you go down and you will see management. When you spot a problem, there may be some things you need to do, depending on what the scenario is. We want you to either do those things or tell us what you would do according to the condition, okay? Now, it may be that your scenario says, someone has got a low blood pressure, but of course you don't have the parameters yet. So in case of, let's say, hypovolemia, when you get to circulation, we will tell you, the blood pressure is, 96/48. That's low. You think, actually, that's low. But hypovolemia is not the only condition where you can have low blood pressure. That can happen in sepsis as well. What you will have is that the differential, which is the temperature, okay? So perhaps when you're assessing the patient in C and they have low blood pressure, you may want to say, yes, I want to give them fluids. So I would, check for an IV line, or if they can have fluids, or check for an IV line, and I would give this much. And then you move on. And you didn't do all the things that you would do. But when you get to E, you realize that actually they have a really high temperature. And you think, actually, this was sepsis. There was other things that I need to do. Don't panic. When it comes for you to tell us what the evidence-based rationale for your interventions is, you can say, actually, I would use sepsis 6, let's say, management. And that also tells me that I would need to do this, this, and that for this patient. So you can add those things there, okay? Does it make sense? Okay, right. Good to know. Good to know, understand. Fantastic. Fantastic. Really good to know. Okay, so in a moment, when I finish this, I promise you, you've been given some time to ask all the questions that I know you probably have in your head already. So what we will do, again, if you watch the video, is when you are doing your assessment, so you're checking the airway, we will say to you, you've done something, right? So you've gone, well, this patient is talking to me, so the airway is patent. We'll go, okay, continue, right? When you're doing a respiratory assessment, for example, if you say, well, I would, in the respiratory assessment, I would count the respiratory rate first, and I do that by observing the chest of this patient rising and falling for 1 minute. When you say that, we'll go, the respiratory rate is blah, blah, blah. Okay, so we will give you the parameters, but you've got to do that little bit first where you go, okay, all right, so thanks for that. I'll make note of this. And then you go, the next thing I would do is to check the oxygen saturation. And I'm just going to put this on the patient's finger. You go and do that, right? And then we'll say the oxygen saturation is, and then you carry on. So we will always tell you what the parameters are, right? But don't waste time. Don't waste time. Be simple and effective, okay? So at the end of the A to E assessment, what we will say to you is there anything else you would want to add? Okay? That means either you have forgotten something or you haven't. We just want you to take a minute to think, have I done everything? If you have, don't start questioning yourself. This is not a tricky question. It's just to give you that breathing space. It may be that you've actually completed everything. We would just say to you, have I done everything? Actually, we will say to you, have you done everything? And you may say yes or no. And if you have any doubts, if you made notes before you went in, Just go over it and go, yeah, I've done that, and that. Oh no, I didn't do this. So that's the opportunity to say, actually, I haven't done this. And you can. But always be conscious of your time. It is half an hour, but you want to use that half an hour to do what you have to do, not just thinking about things that you've already done and you're just not sure. So that's why it's important to have those things there. Then you go to your S bar, okay? So you say, yes, I've done everything, so I'm just going to do an S bar now. And we go, okay, you go and do your S bar. So once you finish your S bar, again, we will say, is there anything else you'd like to add? It's just for you to think for a second, have I forgotten anything? If you haven't got anything to add, just go, no, I don't. Because trust me, that is not a tricky question, but you might have forgotten something. So you need to sort of have that breathing space, right? Okay, if you haven't, or if you have, doesn't matter, you've corrected it now. And then we go, okay, now please tell me the normal parameters for oxygen saturation, respiratory rate, have that ready. So it will save you time as well. And you've got that. We've shared that with you just to make sure that you've all had the same parameters. It's something you learned in your first year, so you've got that. Then we will quickly look at your news chart because we want to know that you've added the news score correctly. So if someone had a news score of 6, we will just check that quickly and then we'll make sure that that's there. If it's there, it is. If it's not, you just lose 2 marks. But remember, that might be quite important when you want to pass your OSCE. Then we go into step 2, and we will say, can you please state the name of the relevant clinical guidelines used for the management of the primary condition of the scenario. So the primary condition will be one of the 4. Remember, if you have put oxygen on someone, and actually what they have is acute chest pain, you can say, I've put oxygen on, and that's according to the British Thoracic Society guidelines. Remember, we want the full name. Or, and then we'll say, great, and for the circulation, what have you done? And you'll say, well, I've used blah, 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 blah. And actually, I would do this, and that as well. Okay, so if there's something that you've not done during the assessment, here's an opportunity for you to say, I would also do this, and that for this patient. Thinking about the management of the condition, okay? So, for example, if they have chest pain, and during that part of the assessment, you'd say, I would give them 300 milligrams of aspirin, and then you go blank and think, well, I don't know what else I would do. When you get to here, you're a bit more relaxed and you go, oh, actually, this also says that I could give morphine. Do you understand? So if you add that there, you will get the marks. But otherwise, if you've mentioned everything, and remember, during the management, you do not need to mention the guidelines, just what you would do according to the guidelines. But you do not need to say, now I'm going to give 2 liters of oxygen because the British Thoracic Society guidelines say so. You can if you want, but I'm just thinking you're going to say that later on anyways. May as well just save yourself some time. But then again, if you've practiced in a way and you're confident, that's fine. It's your way of doing, okay? I'm just trying to give you as much as I can. So we will do that, and then we will move to what human factors affect human performance. And we will say, give me 5. And you will say, you've got the answers there actually. So, and then at the end here, we will say to you, is there anything else you'd like to add? So, every step of the way we'll be like, is there anything else you'd like to add? Just to make sure you are in the right track as well. And then lastly, we will go, okay, what do you think the problem was for this patient? And you say, it was hypovolemia. And we say, actually, it was sepsis. Doesn't matter. We are not asking you to diagnose. So what we'll say in here is that we are going to ask you, what's the pathophysiology behind sepsis, not hypovolemia. Do you understand? So that's what we are going to ask you. And in that, some of you have practiced already. You can just say, it is what it is. But of course, explaining what it is. And once you've done that, we'll say, is there anything else you'd like to add? That's the end of your OSCE. Okay. So what will happen here is that if you finish your OSCE, let's say in 20 minutes time, but the other student hasn't finished yet, you will have to wait for 10 minutes before the other student has finished. You can only leave the room at the same time. That's because we thought it's easier for someone who has finished to wait than the other student panicking with the other student who has already finished, leaving the room and thinking, oh my God, they've done well, they've finished, and they're going. So in that way, no one knows if a student is just sat there thinking or if they've finished. Okay, so we just thought you come in at the same time, you leave at the same time. So you stay in there for that half an hour. Okay, even if you finish 20 minutes in 20 minutes time, that's fine, good for you. Just take 10 minutes to breathe, sit there and wait. Okay, but we will direct you to where to sit and everything. I would say as well, don't bring in too much. Okay, because when you enter the room, you will be asked to leave your things at the back of the room anyways. So, you know, coats and all of that's fine, but please don't come in with your suitcase unless you really, really have to because you're going on holiday. That's happened before and we will accommodate, but just be mindful, okay, of we want the day to run smoothly. Don't want to deal with too many, you know, things coming in the way. I'm sure you won't want that either. So that's more or less what's going to happen in the day, and it's going to go so quick that after you've finished, you will have just thought, oh my God, was that it? And it's done. Right, so I'm going to open the form for questions now. I already have one from Kaylee. It's what about the DDS students? Very good question. So DDS students, we have a list of the students who have DDS, and we have a list of how much time, how much extra time they need. They've been allocated it already. Okay, so within the 45 minutes that we have, which is the 30 minutes for you guys to do your OSCE and the 15 minutes for us to do the marking, you will have, if you are a DDS student, extra time. We will just check with you when you come in that it is either 25% or 33%. Some students as a standard have 25%, some students have 33%, okay? So we are aware of that. All you have to do when you come in is just identify yourself and say to the marker, okay? I'm a DDS student. 1G, okay? So I'm gonna go question by question, just a moment. Do we have to discuss all the conditions or just one condition? For example, COPD, do we have to discuss both chronic? Right, okay. This is a good question. When I'm assuming that you are talking about the pathophysiology question, you can talk about all of them. You can remember, I always said this, you can go as broad as you like, just remember you have limited time. So you may want to say, there are three things that come together under the umbrella term of chronic obstructive pulmonary disease. They are this, this, and that. For example, in chronic bronchitis, that's what happens. Do you understand? We want to know that you have a good understanding of the pathophysiology of the condition. Chronic obstructive pulmonary disease, COPD, is an umbrella term. Okay, so we are aware of that. So as long as you are able to give us a really good answer in relation to the pathophysiology, if you think you have time, you can explain all of them. That's about, you know, think about if your patient was asking that question, how thorough could you be? How would you answer that? Of course, this is not a patient asking the questions, it's an exam. So you have to demonstrate understanding, but also you've got a limited time. So it's entirely up to you. You can, you know, include the three of them or pick one as an example and talk about that. Is that okay, Priscilla? I think that probably answers the questions to some of your colleagues as well. Right. So Stella, for the normal parameters, do we just state them without where the information is from? Yes, you do not need to give reference to the normal parameters. Dale, under the exacerbation of COPD, are we going to use the SpO2 scale 2 to score the patient's stats? Yes, because you're dealing with exacerbation of COPD. So in this case, the patient will have been diagnosed with COPD, is an exacerbation, okay? Dale asks again, okay, so slowly, all right, because I'm being bombarded here. You will be answered. If not satisfactory, let me know, but then we go back. Let's see. Shakirat, clarity on whether to talk about intervention during A2E or at the end. Example is administering oxygen. Okay. Right. I think I've already answered this, but I'm just going to repeat it. When you're doing your management, if you say, I'm going to put 2 liters of oxygen on this patient, and you pick the mask and you put the right mask and the right oxygen, like you saw on the video, that's what we want you to do during the management. At the end, we're going to ask you, what is your rationale for your clinical intervention? You will say, I put that oxygen on the patient because this is according to this clinical guidelines. If you're right, we'll give you the marks. If you're wrong, you're wrong. Do you understand? So if, that's all you asked to do, have a look at the video. You will see an example of exactly what your question was, Shakirat, and that should have clarified it. So, okay, any more questions? We've got 81 people on. Fantastic. So you can talk to each other now and help each other out with any answers that are not provided here. The room has gone really quiet. Remember, this is your chance. Okay, Elizabeth, when assessing the patient's consciousness level, according to ACVPU, and we are told alert but confused, we score 3 or 0. So if you look, if the patient is confused, okay, then if you look at the news 2 chart, you do record it as confusion. So that would score 3, Elizabeth, okay? They are alert, but they are confused, okay? So they would still score a 3. Felicia, is the time used to ask if I have anything else to add part of the allocated 30 minutes? Yes. That takes about 2 seconds for us to say, do you want to add anything else? So yes, it's part of your assessment, Felicia. You're really milking for extra seconds here, aren't you? But trust me, it can really benefit you from stopping you from going the wrong way if we just pause you ever so often. But Felicia, feel free to come in and say, I don't want you to ask me any questions like that, okay? So the marker will probably take that into consideration. If you don't want to be interrupted, you don't want to be interrupted, that's fine. Gintare, I'm hoping I'm saying these names right. We will be getting a sheet for SBAR to be able to possibly make notes. So yes, again, this is the sheet I was talking about, SBAR, okay? Please have a look at this information. It is on Moodle and it has been given to you every session, okay? So yes, there is an S-bar part here. Okay, Jintari, so that's there for you. Inga, for sepsis, we need 15 liters or 2. But what if I realize that perhaps, you know, the patient has got sepsis later? Can I change the nasal cannula to reservoir mask at the end? Many thanks. What I would say is what you can say, you don't need to worry about changing things. What you can say when we ask what's the evidence-based rationale, okay? And you go, actually, I'm dealing with sepsis here. I didn't realize at the beginning. So although I put 2 liters on, the guideline says 15, so I would actually go back and do it. Is that okay? I don't want you to waste too much time. So it's okay to say, actually, put 2 liters on, but as I'm dealing with sepsis, I've realized later on the guideline says 15, so I would go back and change it to 15 via reservoir mask. What you said in your question here would be the answer to your question in reverse. So it's good that you actually realized that too. So all you have to do is just say that. Dale, can I have the SBAR question answered, please? No. This is what you're asked to do. Oh, your SBAR question. Let me go back there. Right. Sorry, Dale. I thought you were asking me to answer the SBAR question. In the SBAR, for the recommendation part of it, do we have to make suggestions in terms of management? Let me go back. Okay. No, what you can say is that I would like you to come and review this patient and, let's say, prescribe the oxygen and the fluids. But no, you don't. You know, the management and the guidelines should cover it all. In the recommendations you can add, you can say, I'd like a line for this patient. I'd like oxygen prescribed. I'd like, 300 milligrams of aspirin. If you say all of that, you basically covered it all anyway. So I don't want you to do it 3 times. Do you understand? So I'm not asking you to do that in the SBAR. But of course, you need to have some recommendations, as in you need to come and see this patient urgently. And I would want you to, to prescribe the oxygen as soon as you arrive. I'm going to leave this open basically because it is to do with your style and how you manage in your time. What I don't want you is to repeat 3 times the same thing. So I'm going to leave it there. Just don't need to repeat 3 times the same thing. Do it wherever you want it, basically. But remember, we will ask you the question, what's the evidence-based rationale for your clinical interventions? And you say, actually, according to, the Resuscitation Council guidelines, I would need to do this, 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 and that as well. Sauda, what if a sepsis patient has COPD of 90%? How much oxygen do I put? That's for you to go and find out. That's Sauda, something we've done in class, okay? So that's what we would want you to know. Do you understand? So how much oxygen do you need to put on if a patient has SATs of 90%? That's part of your exam. And that you will find in the British Thoracic Society guidelines. Shakira, can we still say that I will be administering oxygen even though it need to be prescribed? Okay, good question as well. Yes, it's challenging when you're a student nurse to say I will be putting oxygen on. You can say the guidelines say this. and this is how it would be done. So we can see that you know how it's done. The idea is that in 6 months' time, you will be doing this. So we want to see that you've learned it. So you can say the patient would need 2 liters of oxygen. This is how it's done. James, sorry, you said at the start, but what are the 4 case studies going to be? Hypovolemia, COPD, sepsis, and acute chest pain, James. Have a look at the information. Itoan has answered you, and that's what I think is good, is that you're able to exchange this type of information. Right, any more questions? Okay. Shakira, for capillary refill time, do we need to mention during assessment that we will call for clinician if it's over 2 minutes, or say all the intervention at the end? Shakirat, I really don't understand your question here, so you will need to be asking again. I'm sorry, I don't understand what you mean. You wouldn't call a clinician for CRT, and it wouldn't be over 2 minutes. It's 2 seconds, I think. So what I would say is that you address the problem during your assessment, because we want to see you moving from A to B to C to D to E to then doing an S-bar. Okay, remember, in clinical practice, things would happen slightly differently, but this is just an exam, so you need to demonstrate what to do in each step. In clinical practice, perhaps you would get to see and go, hey, you, can you help me here? Call a doctor, please. Do you understand? Because you were not alone. But here we just want you to go through a scenario, go through an assessment, demonstrating what you would do at each step. So it's not the same as clinical practice, but you need to apply the same knowledge that you would do in clinical practice and you are going to take to clinical practice. That's the intention behind it. Okay. Okay. So I'm just waiting for questions. So Ambreen, how deep should the pathophysiology be? Again, it's entirely up to you. You can be superficial, you will have lower marks. You can go really deep, you may use more time. So that's to do with, when you're sitting at home, Ambreen, and you practice your assessment, you will notice how much time you will have left for the pathophysiology question. Until you do that, no one can answer that question to you. You have to do your own assessment, okay? Pretend you are there as if you were doing the OSCE. See how quickly, how confidently you can do the OSCE, the first 2 steps of the OSCE, to see how much time you would have left for the pathophysiology, okay? You may want to sacrifice some other parts of the OSCE. When you look at the criteria and you see, actually, that's not an essential one, I may want to lose that out. Remember, you need 40%, so you need a minimum of marks. But if you want to give a shorter answer for the pathophysiology, just make sure you have everything else covered, because that will help you to achieve over 40%. But I can't tell you how deep to go in the pathophysiology. You have to do that yourself. You need to do a practice. See how long you take to do your A to E. And if you only have 5 minutes to cover the pathophysiology, then that's not going to be as deep. But if you think, actually, I can shorten a little bit of my assessment here and there and have more time for the pathophysiology, that will be a deeper question. But it's also going to be your skills in extracting that information. Did you actually talk about the right things? Okay. Edward, we will lose marks if you forget specific dosages of medication. No. No. What can happen is you may say, I would give aspirin, right? You are not going to be asked to be given any other medication, but I know that in acute chest pain, for example, one of the indications is you'd be given 300 milligrams of aspirin, right? So if you say I'd be given 200, that's incorrect. So yes, you would lose the mark, but there is no other part of the OSCE where you need to give medication, Edward. Faisal, yes, we would lose the mark. So yes, in answer to my question. Wait, my chat has gone crazy here. Is Lorianne, is there anywhere we can access the practice scenarios from? They are in your Moodle site on the last session. The practice scenarios are there on Moodle, Lorianne. And let me double check, of course, because I don't want to be lying to you. So I'm checking. Session 6. Yeah, you've got all the mock scenarios there. And those are the ones that have been used throughout. So if not, just send me a message directly, Lorianne, and I will change it. So Choma, in acute chest pain, do we need to talk about angina and acute coronary syndrome? Again, this is an answer that I've given before. Same with COPD. No, you don't. It's entirely up to you what you want to include. But I'm thinking that that's quite important, okay? It's acute chest pain will be one of these two. So you may want to say, you know, acute chest pain normally is a sign of angina or acute coronary syndrome. This is what they are. This is what angina is. This is what acute coronary syndrome is. That's how they happen. And that's what makes, you know, that's what forms your pathophysiology answer, actually. And you can say, but in this case, I'm going to talk about acute coronary syndrome. You can pick one or the other, but I think it'd be just nice to say, you know, again, I don't want to influence too much. It's literally about one linking to the other and how they do that. Trauma. So in summary, yes, you know, you would need to talk about at least one of them. So Soda, sorry, Gilberto, I just got confused with COPD again. I know it's 15-liter oxygen via reservoir mask. Right. I don't think COPD you would give 15 liters unless it's an emergency, Sauda. So have a look. I think your previous question was to do with sepsis. But in COPD, you would rarely give 15 liters unless that is a major emergency. Does that answer your question? I hope so. Let me get a sip of water. There we go, Liliana. If the patient is critically ill, stats below 85, needs 15 liter per minute. COPD is no more than 2 liter via nasal cannula. Blood gas and maintaining stats between 88 and 92. Very good, Dale. See, I wish all of this was part of the OSCE because we could be assessing you as we go along. But it's fantastic to see. You perhaps don't realize this, how much you've improved from day one, because of course we lecturers, we are on this side, so we see you day one looking at the guidelines and going, well, do I really need to look at this? Perhaps you already knew, I don't know, but to see you, you know, day one not really knowing what these guidelines were and asking me, do I need to know the title, to actually now saying, this is what it is with so much certainty, is absolutely fantastic. And you need to give yourself credits for that. Perhaps you don't realize how much you know. And I know that the OSCE format is really difficult, and people find it difficult and stressful. But I think when you think about your knowledge and how you're going to apply this in the future is what really matters. So yes, aim for the higher marks because you want to, but don't kill yourself over it. And I am absolutely certain that if you do this at least 3 to 5 times, if you haven't done it so, you will see that it really isn't that difficult. Okay, we want you to do well. So I mean, you know, we've given you all the information so far that you can possibly have for the OSCE, and you know how to put this together. This is how you can show yourself off. You know, this is how you can go, look, this is what I can do. Don't be shy. Come and really show us what you can do. We want to see that. So Ambreen, but when we are not sure about COPD, when we're doing the, right, okay. So you will be sure this patient has COPD because when you read this scenario, it will be evident to you. We don't want to catch you out, and I understand that you may be concerned, but there will be a hint there. I think I said it before as well, that this person you're probably dealing with an exacerbation of COPD, okay? So Ambreen and everybody else, don't try and wonder so much. Apart from sepsis and hypovolemia, which might just slightly differ when you will see the temperature in that, but in this scenario, hopefully you will understand there is a hint as to what is happening to this patient that they have hypovolemia, and what's happening to this patient that might think, well, actually this is sepsis, it's not hypovolemia in the scenario. Of course, you don't have the scenario, so of course you're asking these questions, but I have thought about that, okay? And so hopefully you will too. Katarzyna, what's that face? Come on. I know I've seen you in class. You can't be that panicky. Ituan, I think having to practice 4 conditions is a bit difficult, but we can do it, or you can help us. You have been doing it. So yes, you can do it. Dale, infection is a link to sepsis, I would say, and loss of blood fluid links with hypovolemia through trauma or vomiting. Yes, exactly. So there's going to be something like that, without saying too much, Dale, in this scenario. Yes, you are. Look, I agree. It's a lot to take on board. You know, it's relevant information, however, and trust me, this is something that is going to put you in a really good position to go out there and practice, if not going to save you time and stress when you're out there. It's an important time for you to be learning this. It's relevant information. It's important, you know, information. You want to know this. We're not asking you for no reason. This is something that is extremely relevant to your careers. So, you know, you want to know this really. Is it possible, Chioma, is it possible to pick a scenario from our best 3 topics? Unfortunately not. You will have one, you know. You can't, you know, well, I will tell you why, Chioma, is, you know, when there is an emergency in practice, you can't only just run to the ones that you are most familiar with. Do you understand? So here's the time, and again, I've said this so many times, for you to really get out of your comfort zone. I know it's an exam, but then again, you know, I can't just assess you on what you know best. You've got to be assessed across the board. So it will only show that in one scenario you know better, and in another you may not know as much, but that's okay. That's the reality, right? We're not great at everything we do. So that's the nature of things. Okay, so I've got another 10 minutes left. So if anyone wants to ask any more questions. Okay, Rosette, you might have answered this, but it is a paper we picked blindly. Okay, Rosetta, no, actually, I perhaps haven't answered it with that much clarity. Each station will have a particular scenario. Okay, so you walk in and you have a scenario. What will happen is that each day I will rotate the station. So, for example, if you came in at 9 a.m. and you went to that room and you had that station, you think that that's hypovolemia, and indeed it was. But next day, it might be something else. So if you say to your colleagues, oh, I went to that station, that room, and it was hypovolemia, that's what you're going to get. It's really not. Okay. So it's rotated, is the nature that, we run exams. So it's completely at random. I guess that's what I mean. You don't pick anything. It's going to be there ready for you. Okay, Stella, thank you. Thank you, Jimmy. Good to know. Just to clarify, Lisa, that sheet where we record our prompts, do we bring it with us or will it be given on the day? Okay, Lisa, that will be there on the table for you on the day. You don't need to bring anything with you, nothing, just your student ID, your uniform, and be ready. And bring the answers with you, of course, but in your head, so you can make the notes there on those pieces of paper that we will give to you. Ambreen, if we forget urine output and fluid input during the assessment, can we add later? Absolutely, and that's why at the end we say to you, is there anything else you would like to add? That's an example of something that you may then remember. But if during any part of the assessment you remembered it, you can say, oh, I just need to go back a step because I just want to add this. But be careful, okay? So it might not be worth doing that during the assessment because you then might forget what you were doing now. But yes, you can add that at a later stage. Choma, are we getting the results immediately? No. The reason for that is that it has to be moderated. So we will do moderation on the day, but for fairness purposes, we will release when everybody has sat their OSCEs. Do you understand? So everybody has their results on the same day. And that's what we are going to do, just to be fair to everyone. Abigail, thank you. Thank you too. Chika or Kika, please, will you be the one to choose our topic, or will it be like picked a topic random out of a hat? So like I said, the topics, so the 4 stations will be set and you will have a scenario already there ready for you. So it's randomly allocated. All I do is to rotate stations ever so often during the day as well. So, you know, it it, it is completely at random. So you've got 4 scenarios. Let's say there is 2 rooms, 2 stations per room, 4 scenarios. You go in and you go to that particular scenario. When you come out, what I might just do, I shouldn't tell you this, but I will do, is to just rotate them. So you can't say to the next person going in, it's hypovolemia, because I will have rotated them, and I'll rotate them at random. Do you understand? Because it doesn't matter to me which one is one. It just means that it's all at random. So yeah, so it's just to be fair to everyone. You wouldn't like, I guess, if someone else had, you know, if you were the first one, you wouldn't know. Someone goes in and they can tell everybody else what the scenario is. You're at a disadvantage. So what I do is just to rotate the scenarios. No one knows. But I don't think you should be worried about that. I think you should be worried about knowing what you need to know. So in that case, you can manage any scenario and you waste less energy in trying to find out, you know, the energy you're trying to you losing thinking about questions like this, you would use by adding more information. Stella. Rosetta. Okay, so I've got lots of questions. I'm going in and checking on them. How long do we wait for results? So as with every module, 15 working days. It may be that they will come out earlier. You will know because I will tell you when they come out. So they may not come out until the 3rd week. So it's 3 weeks, so 15 working days. But I will tell you when they come out. Chelsea, can we use paper to scribble during the pathophysiology? Yes. Turn this around if you want. Make a small drawing there. It's entirely up to you. It's fine, Chelsea. You can do that. Thank you, Rosetta. Exactly 15 working days. Shakirat, will the OSCE session be recorded? Well, that's a good question. If they are, they normally record it for external examiner purposes. And we might have a camera in the room. You'll not be pointed at your face. Some of them might be recorded. I'm not sure if they will, and I'm still waiting to have that confirmed. Or just voice recorded, which means like having, you know, a device sitting there recording it. You will not know if the camera is on or not, and it sits like a little bit further from you. So even if it is, will not be interfering with you at all. And it's purely for external examiner purposes. What that means is, for example, they want to see, they want to verify the marking sheet that we gave with what you have done. And so they can cross that information and say, yes, everything is fine. But that's it. Okay. Thank you to Aisha. Philip, are we expected to record textbook vital signs as well? No, Philip, I've already answered that, actually. You don't. So you don't need to give references for the vital signs. Okay, Grace, if we use the wrong guidelines or simply cannot remember them, we will lose significant marks. Does it warrant beating ourselves up over it after the exam? Yes, Grace. This is a very, very important part of your OSCE, okay? And it's a very simple thing to have. So remembering the guidelines is extremely important, and they're not going to be different from the ones you have there already. You already have the answer to this. Is there on Moodle? So have a look, Grace, or ask your colleagues if you don't know this, but you already have the answers to that. All you have to remember is the title of the guideline. Okay. course what goes in as well, because that's how you manage your conditions, and you will lose marks if you haven't done those things. But it's a huge mark that you will lose if you don't know the guideline. Okay, but you have them there, and so I'm trusting that you will remember them. Kahinder, that you are answering Philip's question. I don't think we need to go far anymore. Use the one on the marking sheet. Okay, right. So I think it, is trying to think about anything else you might need to know on the day. Well, I think standard things, if we take a step back, think about your preparation, okay? Practice this at home. You can have someone there as a patient, and you can practice, so you can time yourself. I have to say to you, I've lost account of how many OSCEs I've done in my career so far. And this is exactly how I've prepared myself. This is also exactly, thanks, Louise. Very good to see you here. Louise will be marking you guys, so she came into this session to see what I would say to you. So, even when you have to do a presentation, I've gone for several job interviews and you have to go and do a presentation. So they ask you to do a 10-minute presentation. So what do? You time yourself at home and you repeat it and repeat it and repeat it until you have enough information that is good and consistent, but it's 10 minutes. Do you understand? So there isn't any other way of doing this. This is more than just assessing your knowledge of doing something. Of course, in practice, you will have a limited amount of time that you have to do things. So you've got to have these things in your mind, ready to be done, ready to be said, because it's what can save people's lives in the end. And, you need to know these things. So this is my, Philip, I'll ask your question in a sec, answer your question in a second. So this is my advice to you. Really practice this, time yourself. You will do well if you do that. Do what you can and be honest with yourself, in regard to how much I've studied, how much I've prepared. Do I have the right expectations of the outcome for this OSCE? Okay, don't beat yourself up if things go wrong, but try and stay calm, try and sleep well, drink plenty of water the day before, have something for breakfast in the morning. But above all, trust yourselves, okay? Come in. We are not there to scare you. We're not there to, make you feel uncomfortable. Very much the opposite. Use us. We are there to help you, okay? But again, there is so much we can do. This is your exam. This is your time to really show us what you can do and shine. And I think you need to be proud of what you're doing. Okay, don't come like, oh, I don't know. Show us what you can do. What you can't do, that's fine. But what you can do is what we want to see. Okay. So Philip, will this webinar be available for viewing over the preparation period, and how soon? So you can expect this available tomorrow, Philip. Okay, so from tomorrow on, you can watch it for the entire week. Preparation period started a long time ago, but you still have another week to go before next week. Okay, so if you don't have any more questions, I will be finishing in the next 5 minutes. But feel free to ask any other questions you have. Otherwise, that's it for now, guys. I really want to wish you best of luck. Share that with your colleagues, and I really do think you will do well. I mean, we've done so much work together so far, so don't let yourselves down, and do prepare, make it worthwhile. I'm sure you will. I trust you will. Okay. Thank you, everyone. Really, really nice to see you all here. Inga, sometimes I'm not so patient, but you know what that is? I care. And when you care so much that sometimes you just come across the wrong way. But I really do care about your learning. So that's why sometimes I get frustrated. But it comes from a really good place. I want you to know that. Okay, I can see people starting to log off. I hope you liked the webinar as well. And it was useful. We can do webinars like this in the future. If you enjoyed it, let me know. And again, best of luck. May the force be with you. Absolutely, Liliana. Thank you, Vivian. Okay, everyone. So have a fantastic evening. Best of luck, and I will see you next week. I'm going to log off now. Any problems, send me a message this week, okay? And again, good luck.